I want to talk about spondylosis and stenosis. These are two of the most common diagnoses people have when they're living with pain. Typically, an X-ray or an MRI will reveal if an individual has stenosis or spondylosis. So what are these conditions and what happens to an individual's spine with these diseases? So this is a model of a spine. This is the tailbone, and this is the vertebral body. Now this individual is facing me, meaning we're looking at the back of an individual's spine. These vertebral bodies now have little joints next to them known as facet joints. If we take a side view, now in this view, the individual is actually facing that way. And these little holes are known as foramen. Through these openings, spinal nerves emerge and travel all the way to your hands, to your feet, to your head. And these nerves carry sensation, motor signals, and essentially all input to your spinal cord and ultimately to your brain. Now, the problem though is that these canals can get narrowed, and that is stenosis. Stenosis is just narrowing of any aspect of your body. But if it happens in the vertebral bodies, it's known as spinal stenosis. If there is narrowing of these nerves exiting through the foramen, it can be caused by a disc herniating or a disc bulge which pushes back into the canal. It could be due to arthritic joints or a variety of other reasons which squeeze these nerves. So due to this stenosis or narrowing, you can have pain that runs all the way down your legs, down your arms, and even cause back and neck pain. Stenosis is typically caused because of genetics. Also due to different activities individuals do in their lives, such as sports or traumatic movement or injury. Now, in addition to stenosis causing severe pain, it can also affect function. Some individuals who have severe stenosis may lose the ability to move their legs or lose sensation. So stenosis is a disease that is characterized by pain, but also occasionally motor and sensory changes. The second most common finding is known as spondylosis. Spondylosis is a word meaning many things: degeneration, reduction in height, and it's a very common finding. So if an individual has spondylosis, they typically have degenerative disc disease. Now this is an individual, again, facing this way. This is the individual's back. This is the individual's abdomen. And when an individual has spondylosis, they have degeneration of these discs which space the vertebral bones, as well as a reduction in the neuroforamen, or the opening where the nerves exit. So as a result of spondylosis or degeneration, individuals can develop stenosis, develop back pain, develop pain shooting down to their legs. Spondylosis and stenosis are very common findings, typically due to genetics, environmental factors, and activities that affect the anatomy of the vertebral bones and ultimately function and may cause pain in individuals.